Okay guys, in today's video, we're going to do a little bit of current events. I'm going to show you a few news clips and some diagrams that'll help you complete the last worksheet I gave you. It's called Government Response. Stay healthy, and I'll see you soon. Okay, in this first clip I want to show you, they're going to discuss a couple of things the federal government is trying to do to help with the situation, where each family is going to be able to receive a certain amount of money based on their income and based on how many children they have.
So Nick, talk to us about what families can expect to look forward to.
Yeah, so families can really expect double, basically, of what the individual amount is. Married couples or really joint filers on their taxes can get up to $2,400. And then for every child you have, you qualify for $500 on the rebate. All of this, just as with individuals, is scaled based on income. So if you make more than $150,000, it'll decrease by $5 for every $100 you make over that. But you won't get absolutely nothing over a certain amount.
Oh, that's really interesting. You get a lot of insight onto what the federal government thinks average Americans are actually making, because obviously most people are well below the $150,000 threshold for couples, I would.
Right. So pretty much everyone, or not everyone, but like the great majority of people will get some of that.
In this video clip, you're going to listen to Mike DeWine, the governor of Ohio, the chief executive, give an explanation for some of the things he's done to slow down the spread of the coronavirus in Ohio.
First of all, I have a great director of health, Dr. Amy Acton. Throughout this crisis, we've been relying on the best medical advice we can get. You're right, I'm a politician. I'm not a doctor. I didn't do too well in science, but that advice clearly indicated that to hold the primary yesterday would have been detrimental to people's health. We have 35,000 poll workers. Many of them are older citizens. We also had yesterday, we saw the CDC changed its guidelines to limit it to 50 people in a room. The president then came later, of course, at 10. We can't conduct a primary in Ohio with 50 people to a room. But, you know, another very compelling thing was that we were seeing senior citizens as well as pregnant women, other people who have had a compromised medical history, who were telling us, I was getting texts, and they were saying, I'm conflicted. Should I go to vote, or should I listen to your advice and Amy Acton's advice when she says to do not go out, don't leave the home unless it's absolutely necessary. So we made what we consider the prudent decision to save lives. This was a Democrat and Republican primary. What we're asking the courts to do is to allow us to have absentee voting for an extended period of time after this. The people who had already voted, we have early voting in Ohio. Those votes are just be frozen. So this will get resolved in the courts, but we took this action just like the other actions we've taken to bring separation. We're listening to the experts, and we're going to have, just like every state, a hospital capacity problem.
This last clip I'm going to show you is explaining the importance of staying home and not going out and basically self-quarantining. It's going to explain why we need to slow down the spread of the coronavirus.
We have talked a lot about flattening the curve and how important it is to be mindful of social distancing. If you didn't take it seriously before, here's why you should. Consider this line, the upper limit of our country's medical capability. Most days we're well below it. The system works well. People who are sick receive care. Enter COVID-19. Right now the numbers are low, so low the system can handle it. Yet we know every person who gets the virus is likely to infect at least 2 other people. And that's why the numbers will continue to grow exponentially. Take Italy. In mid-February, the country had 3 cases and no deaths. The next week, more than 300 cases and 11 deaths. The next week, more than 2,500 cases and 80 deaths. The next week, more than 10,000 cases and 631 deaths. It's all pushed the country's healthcare system to its brink. This is what the U.S. will now attempt to avoid by trying to slow the spread over a manageable time. Infectious disease experts call it flattening the curve, and the more people who join, the flatter it gets. Sports fans who can't attend games, college students who won't attend class in person, canceled parades, conferences, concerts, people who wash their hands consistently, the sick who stay home. The more of us who sacrifice the norms of our daily lives, the more this works. Should this fail, people in this country, perhaps people you know, will unnecessarily die in a system that can't handle the spike.
If you take a look at the map that I have up on the screen, you can see that it's color-coded map of the United States. The darkest red states are the ones with the most confirmed cases of coronavirus. And if you notice, we are actually one of the lighter colored ones, which means in Ohio we have less cases. One of the reasons we have less cases is we started taking some precautions early on. They closed down school, closed down a lot of businesses, shut down the gatherings, made it so people shouldn't get together in groups of people. Some of the other states that acted a little bit later, you can see the consequences. Like New York, they have more people than us and they're much more densely populated, but they have 67,000 confirmed cases, so way more than Ohio does. And I realize it's not fun staying home all day, but it is helping to slow the spread of the coronavirus, and it could help prevent the hospitals from being overwhelmed. Take a look at this last worksheet called Government Response. I'm going to help you fill in a couple of these that we saw in the video clips today. So, what is the federal government done in response to the coronavirus? Number 5. We saw a little bit about the stimulus bill they passed. It's going to give money to families and businesses to help support, people during these times when they've lost their jobs. They've changed the unemployment policies. There's been many, many different changes. So one thing you could put is the stimulus bill. Number 6 is your opinion. Do you think they've done enough? Now that's not the only thing they've done, but that's one thing I'll give you for now. Which federal government officials have been working on this? So the federal is going to be the highest level of government, and who have we seen on the news talking about the coronavirus? There's 2 easy ones that I will give you. There's President Donald Trump. And he chose someone to be in charge of leading this against the coronavirus. He chose his vice president. And that is Mike Pence. Okay, and I'll help you out with one more. What is the state government done in response to the coronavirus? So that's that clip we watched with Mike DeWine. He said he canceled something. Or not canceled, but he delayed something. He delayed voting. So he delayed voting to avoid having a bunch of people come together and possibly spread the infection. Now, there's multiple other things you could put for that too. That's just one of the correct answers. Number 4, once again, is your opinion. Do you think they've done enough? So, take some time, see what else you can fill out. I'll be posting one more video this week, probably on Friday, with a couple more current event updates.